How common do you think vaginal discharge is? It is actually pretty common. You guys would be surprised to know that around 1/4 of the patients, gynec patients, are having leukorrhea or vaginal discharge. You guessed that right. Today's topic is vaginal discharge, and hey everyone, this is Dr. Maha Karbik and you are watching Versatile Maha. So how you guys doing? And I'm really thankful to all of you guys for showing all your love and support to my channel. Please keep showing all this love, and those who haven't subscribed to my channel yet, do subscribe it and hit the bell icon so that every time I post a new video you get a notification. So let's start with the topic straight away, guys. Today's topic, we are talking about vaginal discharge. Yes ladies, this one's especially for you, and for guys as well. They should have a knowledge about it too. So like I said, vaginal discharge is very common, and basically why is it so common? Because we have different types of vaginal discharges, and firstly is physiological discharge, then we have inflammatory kind, infectious kind, and parasitic. So let's deal with them one by one. So let's talk about number one, that is physiological vaginal discharge. Now like I said, I don't know if I said it earlier, but physiological discharge is caused by estrogen stimulation. So any time of the month when our estrogen levels are high, definitely we are going to have vaginal discharge. So you guys do not have to worry. As long as there's no irritation, there's no itching, there's no discomfort, then the vaginal discharge is okay, it is fine, it's healthy. Okay, but apart from that, sometimes what happens is in young girls and teenagers, we find that they have leukorrhea, like vaginal discharge. And most of the time when these girls have pain in abdomen during menstruation, or they have increased blood flow during menstruation, they blame it to leukorrhea. But that is not the case. Leukorrhea is different, and it doesn't have to do anything with pain in menstruation. As long as there is a pathological cause like pelvic inflammatory disease, then it is a totally different issue. So what exactly do we need to do about this discharge? Most important is vaginal hygiene. Vaginal hygiene, because you would be surprised, girls tend to be so lazy when it comes to their vaginal hygiene. It is very, very important for you guys, for everyone, for all the girls to maintain vaginal hygiene. You need to wash your vaginal area frequently, and not very frequently, because then again it will mess with the pH balance of the vagina. But yes, every day you should definitely wash your vaginal area. Then again, if you are menstruating, you need to change your pads after 4 to 6 hours, and it's better to wear cotton panties rather than synthetic undergarments. So always prefer cotton over synthetic, and eat right, take lots of probiotics, and diet should be good. So all these basic steps will easily help you cope up with vaginal discharge. So now let's come on to infectious causes. So let's talk about bacterial vaginosis. Now what happens in bacterial vaginosis is that it is, like I said, bacterial infection caused by bacteria. And now what difference does it make to the discharge? The discharge is grayish white in color. It's got a very foul smelling odor. It's got a fishy odor. So this is an alarming sign. Now when should a girl think that, okay, now is the time when I should go and consult a doctor? It is when the girl notices change in color in the discharge. Okay, and if not the color, then consistency of the discharge. If not consistency, there's foul smelling. The discharge is foul smelling, or there's symptoms like itching in that area, or burning sensation, or discomfort. So all these are signs when the girl or woman should go to the doctor, consult her gynecologist, and only then take in antibiotics or whatever the doctor prescribes. Do not self-medicate yourself, because since it is very common, girls tend to talk to each other. Okay, yeah, even I had the same problem and I went to some doctor, and then that doctor suggested me this medicine and now I'm fine. So the girl her friend or someone would tend to take the same medicine and think that it will work on her. But never do that. There's no point of taking self-medication. I always say that I'm very much against self-medication. So okay, that was about bacterial vaginosis. Coming back, now let's talk about yeast infection, right? Like thrush. Now what is thrush? In that condition, it's the discharge is very different. It's got a very curdy white appearance. We call it, in medical terms, we call it a curdy white appearance. It's a very thick kind of discharge, and along with the discharge there's a lot of itching and burning sensation. So definitely it's a fungal infection, yeast infection, and the doctor would prescribe antifungal drugs and do necessary examination. Again, definitely consult a doctor before taking in any kind of medication. So now let's come on to parasitic causes. Parasitic causes, may we have Trichomonas vaginalis. Trichomonas vaginalis is a condition, again, in this the discharge changes. The discharge is greenish yellowish in color, and again the vagina is itchy and it's burning. And on examine it also, I'd like to say that it is caused by a parasite, like it said, parasitic, and it is transmitted again sexually. Goes without saying, practicing safe sex. And apart from that, one should definitely go to a doctor, because it can be a little morbid for the patient, right? And once on examination, we could see a very different kind of cervix. We usually call it strawberry cervix. This is a little serious. It can cause problems, abortions in pregnant females. So if at all women find any difference in the color, odor, a feeling of discomfort or itching, one should definitely go to doctor, and do not just become your own doctor, go through the internet and self-medicate yourself. So that was about that. So basically, take home message number 1, maintaining vaginal hygiene is very, very important, because unlike males, females' genital area is very small, and it's more prone to infections. The infection ascends up very easily. So genital cleaning, vaginal hygiene is very, very important. So drink lots of water, stay hydrated, take in a lot of probiotics, eat healthy, and like I said, do not overwash the vaginal area. Sometimes girls think, okay, no, I need to clean the vaginal area, and just applying soap and everything and doing it too much. Not to be done, not at all, because then again it will mess up with the pH of the vagina. And guys, little bit of vaginal discharge is very natural, and it is supposed to be there because it acts as a defense mechanism against certain organisms, right? So vagina is supposed to be moist, it is supposed to be lubricated. Dry vagina in itself is an abnormal condition. So vagina needs to be lubricated, and that's it, guys. Do not panic and take care of your vagina. That was it from my side today. I hope you guys found this video useful. Let me know in the comment section as to how you found it. And yeah, that was it. I'll see you guys in another next fun video, and take care, you guys. Bye.